China is battling its worst coronavirus outbreak since the pandemic began. The extremely contagious variant known as stealth omicron is challenging the government's zero COVID-19 strategy. Millions of people are under lockdown. Katrina Yu reports from Beijing.
Jilin province in China's northeast is the latest epicenter of the country's coronavirus outbreak, with hundreds of cases confirmed there in the past few days. Mass testing is underway and a makeshift hospital designed to accommodate 1,500 is now open. Further south, similar scenes in the city of Qingdao. People there have been ordered to take COVID-19 tests by community medical workers.
We have set up 6 testing sites in our community. Due to the tight schedule, we have to conduct testing overnight.
Cases of the Omicron variant are surging nationwide, with thousands of infections reported in recent days. It's the biggest outbreak here since the pandemic began. More than 17 million people in the city of Shenzhen have been put under lockdown for at least a week. People can only leave home to buy necessities. All public transport has been suspended. The forced closure of businesses and factories in the tech hub saw China's stock markets drop on Monday. In Shanghai, parks, schools and universities have also been closed. Authorities are doing all they can to prevent large outbreaks in major cities. Our team in Beijing is among the millions affected by China's strict COVID-19 controls. Because one Omicron case was found in our office building last week, we've all been told to quarantine and work from home until further notice. Rapid antigen tests, or home testing kits, have been made available to the Chinese public for the first time.
Antigen tests cannot replace nucleic acid tests, but they can help identify the possible source of infection in a timely manner before nucleic acid tests are conducted.
Experts abroad have criticized China's zero-tolerance strategy as unsustainable, but Beijing has doubled down on its approach, saying it's kept deaths from the virus to a minimum. Katrina Yu, Jazeera, Beijing.
So what is this variant known as stealth omicron that's fueling the surge in China? Well, its proper name is BA2 lineage of the Omicron variant and was first discovered in November. It's the fastest spreading variant known and by February had become dominant worldwide. Well, let's speak to Dr. Bharat Pankhania about this. He's in Exeter in the UK and he's a specialist in infectious disease control and a senior lecturer at the University of Exeter Medical School. Thank you very much for being with us, Dr. Pankhania. So everyone, of course, keeping a close eye on this subvariant of Omicron. What's causing, what do you think you can tell us more about this? Does it have the capacity to drive a large new wave of infections?
Well, what we do know is that it is more transmissible. In other words, it's easier to get infected by compared to the B1 Omicron variant. Having said that, the good news is that it isn't more severe disease causing and it isn't extensively antibody bypassing, in other words, vaccine bypassing. The issue with China, Denmark, United Kingdom, India, where they are seeing a surge in the B2 lineage, is that variants arise and variants will find people to infect. And in China, where they pursue a zero COVID policy, it's also more draconian in that there are preventative measures, lockdowns, shutdowns, so on. But these are all precautionary measures that China has very successfully undertaken.
Omicron, doctor, was already a highly transmissible variant. Why is this one even easier to catch?
Well, as it changes its shape, the spike protein, and so the B2 lineage has got more changes, and those more changes equal a change in the shape of the spike protein. And that change in the spike protein allows it to attach to human receptors even easier than Omicron. And that's how it becomes more infectious. One more thing about it is that it also causes infected cells to clump together. And when they clump together, there is intercell signaling. And with that intercell signaling, they can make more of those virus particles compared to the previous variants where there wasn't that much more cell clumping.
Right. Now, Pfizer has said, Dr. Pankania, that a fourth dose of its vaccine will be needed for older populations, especially to help fend off another dose. Will the existing vaccines work against this BA.2 variant?
At the moment, it appears to be working and holding. So what we want is more of those antibodies, because many of those antibodies are bypassed by the B1 and the B2 variant. So what we want is more of it to overcome the partial bypassing of the antibodies that we produce. That is all the solution we have. But a better solution, a much better solution, is to suppress infections globally. If we suppress infections globally, there is less of these variants to emerge and much better for global health.
Thank you so much for talking to us about this. Thank you for your expertise, Dr. Bharat Pankania, joining us there from the UK.
Thank you.
France, meanwhile, is lifting most of its COVID-19 restrictions, including mandatory vaccine passes and the need to wear masks in schools, shops and offices. Masks will still be needed on public transport and in hospitals. The move comes despite a rise in infection numbers. France is also rolling out a fourth dose of the vaccine for those aged 80 and above.